This 61-year-old female received an allogenic stem cell transplant for recurrent non-Hodgkin's lymphoma 6 months previously and was referred now for recurrent gastrointestinal blood loss, diarrhea, abdominal pain, and weight loss. Prior upper endoscopy, colonoscopy, and abdominal CT scan suggested graft versus host or GVH disease, and this capsule study was performed to determine the extent of small bowel GVH involvement. These ulcerated nodular changes were seen throughout the small bowel and are typical for GVH enteritis. Subsequent biopsies were performed. The colonic mucosa appears injured and regenerative, with large growing nuclei extending high up the crypts towards the surface. Higher power shows nuclear fragmentation or apoptotic bodies, as shown by the arrows, characteristic of graft versus host disease. Graft versus host disease occurs following 30% of well-matched allogenic bone marrow transplants and is due to the effects of stimulated allogenic T-cell lymphocytes and cytokines affecting epithelial cells primarily in 3 target organs: the skin, the liver, and the intestine. Intestinal involvement is usually accompanied by symptoms of abdominal pain and diarrhea. The lesions seen on this video capsule study are characteristic of enteritis secondary to graft versus host disease.